What's up, guys? Welcome back to my YouTube channel. Today we're going to be talking about CARMS applications, which are the Canadian applications to get into residency from medical school. This was requested as one of their videos by a bunch of people on my Instagram. If you don't follow me there, at Radiology, you can ask a lot of questions there, which I will translate hopefully to some videos that you can see on YouTube. So be sure to follow me there and look for the content that I post on Instagram. So like I said, we're going to be talking about the interview process, the application process, and without further ado, let's get started. Alright guys, so in today's video we're going to be talking about the application process to getting into radiology residency. Specifically, I'm going to be talking about the CARMS applications, which are the Canadian residency applications, but this advice will apply broadly to anyone who's applying from medical school into a radiology residency program. I speak from experience, as well as being junior and chief resident. This experience has allowed me kind of an insight from both sides of the story. Obviously, me being an applicant from medical school applying to radiology residency, as well as me being an interviewer and an application reviewer and someone who's on the other side of things and what we look for in an applicant when we are asking the questions as to if they should be in our residency program. So we're going to be talking about, from the get-go, in medical school, doing electives in radiology, what to do, what not to do, and how to increase your application in applying to the radiology residency programs. The application process, the written part, the kind of bio that you do about yourself, your letters of recommendations, and everything to do with the written application. And then we're going to go on to talk a little bit about the interview process. With questions and types of answers and things that might help in general during an interview. And then finally, just kind of say some overall thoughts about picking a program to do for radiology residency, mainly speaking towards Canadian programs, but information that will also apply to anywhere else. So without further ado, let's start. So the first part of any application into a radiology residency program is going to be the elective. The elective happens in third or fourth year of your medical school, depending where you went to medical school. This is a chance to do a month rotation or 2 weeks rotation in the Department of Radiology, where you get to kind of act like a fly on the wall and get your hands wet a little bit and see what the field is all about. So it's a good chance for two things. The first is for you to interview the program and for the program to interview you. It's kind of like a long interview process because it allows for the residents and the staff to meet you, to figure out who you are, why you're interested in radiology, and to kind of get a feel of if you would fit in the program. So a lot of that has to do with, are you someone who demonstrates interest first and foremost, right? You want to show that you're interested in the field, but at the same time, you're not someone who's super kind of intrusive or strong kind of, personality type that doesn't allow for teachability. That's a big thing in radiology residency, is that you need to be able to be teachable, you need to be a team player, you need to get along with the residents, and you need to be able to kind of, take guidance from your staff as well. You also, at the same time, need to be motivated, you need to be ambitious, and you have to be adapt to seeing images, right? Because a large part of radiology is looking at the screen and diagnosing things. So do you have the eye for it? Obviously that is something that gets trained over time, but there is a proponent of, do you have any sense of finding where the abnormality is? That being said, a lot of it has to do with how much do you know medicine. What are you looking for when you're trying to identify a bowel obstruction? Whether you're in radiology or not, you probably should know that when you're going through medicine. And so it really depends on how much you've learned, how much you've gone through, and what you can apply to real world diagnostics. So your elective time is a chance for residents, because a lot of the times they get to spend time with you while you observe them on a rotation. The rotation usually goes with, multiple different residents in different parts of their residency, whether it's junior or senior, preparing for call or preparing for their exams. You get to see, different levels of information, levels of types of modalities, depending on, what they're doing on their rotation, different types of sub-radiology specialties like MSK, neuro, abdominal imaging. You get to see them do procedures and all sorts of things. And at the same time, it's really a dynamic that you get between you and the resident to see, am I compatible with this group of people? Do I fit in what everyone else is kind of like? Am I going to benefit from my seniors, my juniors, to guide me through my residency? You are evaluating the program itself and saying, how much do they teach? Are their staff taking care of their residents? Are the staff approachable? Are the staff mean? Are the staff willing to teach, willing to take time out of their day to teach? And a lot of the times that is obvious, right? Like you kind of tell right away from that sort of thing, but it's not intuitive that you should be also evaluating the program when you're doing an elective. Elective time is face time. So when you're on rotation, people see you, people get your name, people know that you're applying to radiology. So they put you kind of in their storage. As a resident, as a chief resident, I've always interacted with our elective students. Where I go, we hold a chief residence round the second week of every rotation, and that allows for students that are on rotation to make a presentation, kind of like a hot seat case for one of our residents, basically given a case by by the chief residents, that will be given to another resident, usually a junior resident. They take the case, they try and figure out the diagnosis, they give a differential diagnosis, and then the medical student goes on to talk about the subject a little bit deeper. So they've put in a little bit of time into figuring out what the differential is, what maybe the pathophysiology is, and some more information that might help remember what the case that we were talking about was. So, that is a chance for me, number one, as chief resident, to see, what are your presentation skills like? What is your knowledge base like? Are you someone who is teachable? Are you able to teach others? And really just an overall kind of feeling of, is this person ambitious? Is this person willing to work, spend extra time to make this presentation and do a good job of it? And at the same time, you as a medical student are able to learn something, to teach others, to put it on your CV that, hey, I've done this presentation in front of a whole bunch of other people. But it's a low kind of stress environment that, hey, this is our group of residents, this is what we do, this is how we learn. Do you fit in? Do you not? And to see how, that fits for you. So, I really take a lot of that information when we're dealing with the interviews, and, when we're re-evaluating people after we've seen their application and their interview. I look back and I say, were they good on service? Like those 2 weeks, like how did I feel about them? Sometimes I write notes, sometimes I write memos, and I say to myself, oh yeah, this person really stuck out, or, this person was really kind of difficult, and a lot of people talked poorly about them, or greatly about them, or yeah, they actually did research with me, or they expressed interest with other residents to do call, etc., etc. So these are very important kind of internal details that happen on electives that are very helpful for trying to get yourself out there. The elective also allows for the staff to see you, so staff also are involved in interviews, and they'll recognize your face, they'll recognize the time that you spent with them, hopefully a positive recognition, and then they'll say to themselves, oh yeah, I remember this person, they were interested, they spent some time with me, they asked cool questions. They're not going to remember that you didn't know that piece of information, or that you knew so much about MR imaging, mainly that it's like, okay, yeah, they were a good person, I enjoyed my time, and that makes sense with the interview that I just had with them, I'm going to score them high. So it allows you some of that face time, which is really important in the elective, and it allows you to see as a medical student, do I like how the program's set up? Do I like call that they do? Do I like this, the environment that there is, which is a big part of residency, is the environment of the residents themselves. Are they happy? Are they taking care of each other? Is there guidance from senior to junior, etc.? All in all, elective experience is super important, which builds upon a lot of the things that you're going to put in your application, in your written application, for when CARMS, or your application process, begins. So let's talk about that next. So when we're talking about the written applications for getting into a program, that usually consists of a personal statement, reference letters, a CV that entitles, some of your research experience, publications, your volunteer experience, anything that you would have done in medical school and prior that would help your application. And then sometimes there's supplementary questions that are specific to a program that help evaluate, your fit to the program as well. So all in all, this written application is your kind of footing into the interview aspect of things. This written application is largely reflective of your interest over the last years of medical school. So it shows that you have had an interest in radiology because you've done a bunch of radiology electives, or things that are similar to radiology to increase your knowledge in, which radiology is pretty broad. So doing an elective in internal medicine or surgery or pathology, these are all things that can be spun in a way where it's like, yeah, okay, I did these things to gain general knowledge to apply to my residency program in my future radiology career. The application process is going to reflect any publications or research that you got involved in, because it shows your dedication and time commitment, as well as your interest in the field. So if you've approached a resident for a case study and you're involved in that with another staff and it gets published, or even if it doesn't get published, those are good things to put on your application, because it shows that, hey, this person is clearly interested and has put in some time and effort into learning something outside of their comfort zone. Really good. So the application process is also a way to kind of show yourself, I've won this scholarship, and I've performed well at this subject, or I've, also received this award for whatever. It's very much like when you were trying to get into medical school, your application that reflected, prior to medical school, undergrad, and your high school ambitions. It really is reflected back into your medical school application to get into residency. And so it's really a form of showing, okay, this is the person that I am, these are the things that I've accomplished. And it's kind of overviewed by your personal statement, which is usually specific to where you're applying to in the residency program. You want to use insider things that you've gained knowledge on when you talk about a program specifically, because you did an elective there and that this place's call is heavy, but that the support of the residents is strong, and these are things that you look for, and etc. You're kind of playing the strengths of that program that you want to get into. Personal statement is your chance to kind of differentiate yourself, like, hey, I'm a person who was late to the game and didn't know that I wanted to do radiology, and these are the reasons why I then wanted to do radiology and what I've done in that short limited time, to kind of give an information to the person who's evaluating the application as a whole, to say, you know what, they only had like a couple radiology electives, it doesn't really make sense. Are they really applying to just radiology, or do they have another goal in mind where radiology is kind of in the back burner? So these are information kind of tricks that you can use to help with your application process in general. And then your letters of recommendation. So the letters of recommendation are a pretty big deal when it comes to trying to get something that represents the program. In my opinion, this is very much my opinion, not of the opinion of anyone that, is actually valid per se, but I would say that, if you're able to get a recommendation letter from a person that actually goes to the program or was affiliated with the program, then the people who are evaluating and they see their colleague's letter and they're like, oh, this letter clearly means something to me depending on how I feel about my colleague, right? So it's kind of a nice thing to say, hey, I have this one letter of this school to give to this school, like it's something that they could say, oh yeah, Dr. So-and-so, obviously if they've spent time with them, this is, true, this is real, as opposed to the generic, overview recommendation of this student is in the 50th percentile of what I've seen in my past, blah, 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 blah. And in the same vein, it also doesn't matter in the sense that if you have 3 good, strong recommendation letters from anywhere else, use them. The stronger, the better connection, the more time you've spent. These are recommendation letters. They need to reflect that. But like I said, it is nice when you see someone that writing a reference letter for someone else and saying, hey, like obviously this Dr. So-and-so, I've worked with them, I respect their stuff, and it makes sense that they're saying good things about this candidate, I'm going to believe it. So I would say that during your elective time, when you're spending time on service, try and get a letter from someone who you feel comfortable with, that you've had a good time with, that you spent a couple of days. And that's another question I get a lot. It's like, well, in radiology you only really get to spend 1 or 2 days with the staff, like how do you get a letter? Just ask. That's the name of the game. Unfortunately, that's how our electives work sometimes. You only get to spend a couple days with people. If you feel like you need more time, try outside of the elective to work with them. Do a couple more days of shadowing. Do a case study with a resident that's working with that staff. Allow there to be a little bit more things to talk about. But in reality, that's kind of what you have to do. You spend some good days with that person, you make a bond, you felt comfortable with them, ask them for a reference letter. Worst case scenario, they write you a reference letter, and you just don't use it. So really, it's up to you at the end of the day. But that's what I recommend for reference letters. So that sums up all of the kind of written aspect of the application. That and your elective experience, whether or not you've done elective at the site, kind of guides your interview, right? So did you get an interview? Did you not get an interview? For the most part, if someone who's interested in radiology, they've done elective at the place and they have a good application, they're likely going to get an interview. Interviews are limited though, and so it is important that if you really want to go somewhere, I think you should do an elective there. I know in today's times, in COVID times, that we're limited to where we can do electives, and really traveling is not an option at this time. So that becomes a whole new hurdle that I've seen our last 2 years of acceptances having to deal with. I know it's frustrating and I know it's tough, but just understand that the people who are interviewing you and assessing your applications, which I have during this time, understand that. So they recognize that. So people are going to gravitate towards where they are currently, right? Where in the medical school they've done, what program they have. So that's going to be the natural gravitation. But if you are from another place, do not be afraid, like apply there. Try and get your connections there, maybe reach out to a couple people there, some of the residents, some of the staff, see what you can do to get your foot in the door. But also understand that everyone's understanding. Interviews are now virtual. They're on Zoom and they work well. Obviously it's behind a screen, kind of like you and I right now, but as long as you are prepared for the interview as you would have been in person, they're similar. The same attributes are going to be easy to identify by someone on the other side of the screen when they're listening to you speak and answer questions. So just know that the interview process hasn't changed that much and it's not really that affected by you being in person or not. So with that being said, let's talk about the interview. So the interview is pretty standard. A lot of people do, a couple different groups within, the residency program. Most of it is multiple mini interviews from what I've seen in Canada at the residency programs. However, there are still some panel-like interviewers that kind of go in the old school fashion, but overall you're going to be asked a lot of the same similar themes. You can expect the generic questions of, why radiology? What makes you a good candidate for our program? These are questions that I think everyone should be ready for, have an answer for, and format in a way that is acceptable. Interview skills are probably a whole video topic on themselves, so maybe if there's some interest in that, leave a comment below. Maybe I can do some more specific interview skills type videos, and you can see those types of that type of information there. But in general, you're going to prepare yourself for multiple mini interview session where there's limited time, usually 10 minutes per station or something of the sort, where you're asked a couple of questions and you're asked to respond. Sometimes they're ethically based questions, sometimes they're kind of decision-making questions, sometimes they're skill testing questions. So, in Canada, there are some places where they ask you a skill testing question where they want to identify a basic anatomy image, or they want to identify a basic pathology image. And so, there is a little bit of like, what did you learn? Did you pick up anything during your elective time? Did you is your interest genuine? And to be honest with you, a lot of people don't get it right, and that's fine. It's just a matter of, what experience have you had, and that's really just part of the interview process. Overall, the interview and the application get scored together. People kind of give an overall assessment of you. Discussions are made and rank orders are put, just like when you put your rank orders of what schools you want to go to and what programs you want to rank. The same happens for the school themselves and the program themselves. The rank process in Canada is the CARMS match. The match process is similar to the States, where the rank is ordered. You get matched according to your rank and the school's rank, and that's a binding match to which, once you get revealed on match day, is the school that you would be going to. There's a whole bunch of topics related to match day and matching into a program and having backups and etc. I don't think this video is gonna be it's gonna be too long to talk about all those issues and problems related to that. So we'll leave it at there for now. All in all, I think, a couple tidbits of tips and tricks to the process of CARMS in Canada and application to getting into a residency program in general, to anywhere you're applying to. If you guys like this, leave me some feedback, write some comments, like and subscribe to the YouTube videos. Hope you guys enjoyed this, and we'll see you in the next one. Peace.